Deborah Wallace was among the generation of ecologists who pioneered environmental impact assessments in the 1970s. She transferred ecological analytical approaches to urban functioning and public health with her husband co-worker, Roderick Wallace. She studied the causes, dynamics, and consequences of the 1970s massive housing destruction in New York City for almost 50 years. The epidemiological process of COVID-19 in New York depend on the consequence of this disaster. Deborah will speak on the Bronx as the epicenter of COVID-19 in New York City. It is an honor to introduce Dr. Deborah Wallace.
The Bronx was the epicenter of the metropolitan region, and this is described in the book that Roderick and I wrote called COVID-19 in New York City, an Ecology of Race and Class Oppression. When we found that the Bronx was the epicenter for the metropolitan region, other people found that the metropolitan region was the epicenter for the country. So the Bronx was actually the epicenter for the entire country. We decided to go into some historic context for this. This is the map of redlining from 1938, redlining in the Bronx. Redlining was part of the New Deal, and we all know that the purpose of the New Deal was to save capitalism at a crucial point in the United States history. This red area in the Bronx was where the radical Jews lived and where they were experimenting with things like cooperative housing, which infringed on capitalist real estate. This was 1938. There were Nazi rallies being held in Madison Square Garden by this time. In the 50s and 60s, this little photo shows the urban renewal zones, which occupy the same area as the redlining did. So first there was redlining, that was one blow. Then there was urban renewal, that was the other blow. Then we had planned shrinkage, which was the cutting of essential services to certain neighborhoods that were labeled as dying. This is how the fire companies were cut. The E is for engine, L is for ladder, B is battalion, and S is squad, concentrated in the same area that the redlining was and the urban renewal. The map on the left shows the effect of this. The percent of occupied housing lost between 70 and 80. The fire companies were mostly cut between 72 and 76. There were areas that lost 80% of their housing. These people that were burned out and that had abandoned buildings, landlord abandonment, they moved into the north. They moved north of this zone. So we have a new population shift here. Planned shrinkage didn't end in the 70s. This is a map of what happened in the 1992 sanitation department budget. These striped zones are community districts that lost between 50 and 70% of their garbage collectors and street cleaners. These wealthy white areas, like the Upper East Side, actually gained. So they were taking from the poor and giving to the rich in the sanitation budget. Most of that happened in the Bronx. Of the 10 districts that lost huge quantities, 6 were in the Bronx, none in Queens or Brooklyn or Staten Island. And the ones in Manhattan, you had Spanish Harlem, Louis-Ida, and this area was 1/3 Latino. This little map shows voting participation in the 2021 mayoral election. The South and Central Bronx was the largest area with the lowest voting participation. This was lower than 20% of the registered voters in this area voted. Then we have markers of urban decay that developed between the early 2010s and 2019. 2019 is the context of the first wave of COVID. So drug deaths in all 12 community districts of the Bronx increased hugely between 2010 and 2019. Low birth weights also increased a great deal in 10 of the 12 community districts of the Bronx. Homicide rates increased greatly in the 6 community districts that had been subject to redlining, urban renewal, and plan shrinkage. So this is the context of the first wave of COVID-19. This is a map of the number of large fires in 2019. This is the northern half of the redlined area, and this is where the populations that were squeezed out during the burning of the Bronx went. So we have these communities that are still being disturbed, still being disrupted, still having disengagement, social, political, and economic disengagement forced on them by being burned, and it's still going on. So this was the context of why COVID could not be grappled with in the Bronx, because of the disruption, the incredible oppression of these communities. They refused to cooperate with the testing, the tracking, and the isolating. It was a complete refusal. The people who were sent out by the health department, the trackers, could not get cooperation in the Bronx because these people had been completely oppressed for many, many decades. Their grandparents had been oppressed, their parents had been oppressed, and they were oppressed. And that's what I have to say.